Yeah, the next topic here is the terms related to muscles, vessels, and bones. So, understanding the terms related to these structures is a bit most important to understand the gross anatomy. So, the terms related to muscles, first one. So, origin, insertion, belly, tendon, aponeurosis, and raphe. These are the five terms we use in the gross anatomy to describe any kind of muscle. For example, biceps brachii, as shown in this picture. So, origin. What is an origin? An origin is the one end of the muscle which is relatively fixed during the contraction of the muscle, which is less mobile. That, for example, this is the, if if we take biceps muscle as an example, this is the origin of biceps muscle. Biceps is called biceps because of two heads. There is short head and long head of biceps. The short head of biceps is originating from the coracoid process of the scapula, and the origin of long head is from the supraglenoid tubercle. So there is a tubercle, that is a term used to describe the bone projections, that is called tubercle. And bony projection is called as tubercle on the glenoid cavity, on its superior border. It is called a supraglenoid tubercle. From this tubercle, the long head of biceps will have its origin. So this is called as origin. It is a relatively fixed structure in the muscle, or relatively fixed end of the muscle. Insertion is the relatively mobile end of the muscle, the end of the muscle which moves during the contraction. So that is called as insertion. For example, this is the insertion. There, biceps tendon, biceps insertion has two things, one tendon and an aponeurosis. Biceps tendon is inserted onto the radial tuberosity on the upper end of the radial bone. Next, the biceps aponeurosis is a sheet-like fibrous process, sheet-like fibrous tissue, which is, it is supporting the neurovascular bundle in this region. Yeah. So next one, the terms origin and insertion are sometimes interchangeable when the origin moves and insertion is fixed. Yeah. So next, the belly of a muscle is nothing but the fleshy contractile part of the muscle. For example, for this biceps muscle, this is called as muscle belly. The central part of the muscle, which is fleshy and is a major contractile part, is called as belly of the muscle. As we already discussed, tendon aponeurosis. Tendon and aponeurosis are the fibrous non-contractile tissues. So these do not have any contractile tissues. So these are fibrous tissue, and if it is cord like as shown here, if it is like, or if it's a cord like, it is called as tendon. Yeah, if it is cord like, it is called as tendon. And if it is a sheet like as shown in the here, as shown in the here bicipital aponeurosis, if the instead of cord like architecture, if there is a sheet like architecture, it is called as aponeurosis. So aponeurosis and tendon are different terminologies. Use it for non-contractile part of the muscle, which usually helps in insertion of that particular muscle. What is raphe? Raphe is the fibrous band which is made up of interdigitating fibers, that is crisscross fibers of tendons and aponeurosis together. Unlike a ligament, it is stretchable. Yeah, ligament is non-contractile, it is not stretchable, but raphe is stretchable. Ligaments are fibrous inelastic bands which connects two segments of the joint. Yeah, the next thing is the terms used for describing vessels like arteries, veins, capillaries, and anastomosis. What are arteries? Arteries are the major vessels which are carrying oxygenated blood away from the heart, with the exception of pulmonary and umbilical arteries, which carry deoxygenated blood. Arteries resemble trees because of their branches, that is arteriole. So this is the artery, major oxygenated blood carrying vessel, and it is opening into its branches called as arterioles. Arterioles will end into capillaries, which will communicate with the branches of veins called as venules. These are venules, and these venules will open into valvular structures called as veins. Yeah, so what are veins? Veins are deoxygenated blood carrying vessels which towards the heart, with the exception of pulmonary and umbilical veins again here. So capillaries are the network of microscopic vessels connecting arterioles and venules. So this is the capillaries. Yeah. Next, what are anastomosis? Anastomosis are something another important terminology we come here and over. So anastomosis is a pre-capillary or post-capillary. It is not, anastomosis is not synonymous to capillaries. There can be pre-capillary, post-capillary communications between the neighboring vessels. If there is a communication between an artery and artery, it is called as anastomosis. If there is a communication between a vein and vein, it is also called as anastomosis. If there is a direct communication between the artery and a vein, it can also be called as anastomosis. So anastomosis are communications between the two major vessels, like artery it's called arterial anastomosis, vein veno-venous anastomosis, artery and vein arterio-venous anastomosis. What is the function of this anastomosis? Anastomosis will be helpful in bypassing the blood whenever there is a problem with its original pathway. It can bypass the blood to maintain the blood flow. That's the main function of an anastomosis. Next, the terms used for describing the bone features. Yeah, here we need to know, while describing bones, we have something called as elevations. So something called as depressions, openings, cavities. Okay, these are some terms are used to describe bones. Linear elevation may be a line, can be called as a lip, ridge, crest, one and the same. So a linear elevation on the bone, that structure can be called as a line, a lip, a ridge or crest. These elevations will help for insertion of the various muscles surrounding. Various surrounding muscles will undergo insertion on these bony surfaces using these some linear elevations. There can be sharp elevations. Some sharp elevations are called as spine, styloid process. Over here, this is a sharp elevation. This is a sharp structure coming from this temporal bone. Coming from this temporal bone. This is called as styloid process. So styloid process or cornu, greater cornu, lesser cornu or horn. These are seen in sphenoid bone. So these are also sharp elevations of coming from the bone, or hamulus. These are the terms used for describing a sharp elevation. Next, rounded or irregular elevations, like we seen in the lower part of the arm and lower part of the humerus or the lower part of the femur. The rounded elevations, they are described as tuberosities, epicondyles, malleolus, trochanter. All these things we will discuss. Okay, and the ramus is a broad arm. Or a process projecting from the main part or the body of the bone. Yeah. Next, what are depressions? Depressions is nothing but something, depressions on the bone. Any depressions on the bone can be given the names like pit, impression, fovea. Fovea is also synonymous to depression. Fossa, groove or sulcus, notch or incisura. All these terms are synonymous to depression. Openings can be given the names like foramen, canal, hiatus or aqueduct. Hiatus, canal, foramen, one and the same. All these together are synonymous to openings in the bone. Or cavities is a large cavity within a bone is called as sinus. If there is a large cavity inside the bone, that is called as sinus or cell or antrum. These terminologies are given for cavities in the bone. Okay, smooth articular surfaces on the bone can be demonstrated as, or can be given name as, facet, condyle, head, capitulum or trochlea. All these terminologies are given to smooth articular surfaces. But the irregular rounded surfaces are given the names like tubercle, tuberosity, epicondyle, malleolus or trochanter. Yeah. So you can see this is the femur bone. Yeah, this is the femur bone on its anterior surface and this is the posterior surface. So you can see the rounded structure, that is head, and here you can see there is greater trochanter, lesser trochanter, which are irregular surfaces. So you see trochanters, tubercle, trochanter, all these terminologies are given for rounded or irregular elevations. As you can see, the rounded or irregular elevations of, and on the anterior surface of the femur bone, we have this rounded irregular elevations. They given the name greater trochanter and lesser trochanter. Yeah, similarly there is lateral condyle and medial condyle, which are also the rounded elevations on the bone. These terminologies are given, and you can see the lateral supracondylar line, medial supracondylar, these are elevations. These are sharp straight elevations. These are linear elevations on the bone. So these given the name line over here. We can also there are also terminologies called as crest. There are also terminologies called as ridge, lip, upper lip, lower lip, lateral lip, medial lip. On the lateral lip, medial lip, for the humerus bone, these are also the linear elevations. Next, tuberosities. So there is a, what is a tuberosity? Tuberosity term is given for a rounded or irregular elevation. So there is a rounded or irregular elevations in the upper end of the femur, which is given the name gluteal tuberosity, where the gluteal muscles undergoes insertion. So where the gluteal muscles are inserted. So you can also see lips, linea aspera with two lips. These are the linea aspera with two lips, means these are two linear elevations. Okay. Yeah, process. Any rounded elevation can be given a term process. Tubercle, this is a rounded elevation, regular elevation. Epicondyle, capitulum, trochlea, these are the names given for, yeah, these are the names given for rounded or irregular elevations. Epicondyle, malleolus, trochanter, yeah, or either or smooth articular surfaces. Okay, or smooth articular surfaces like facet, condyle, head, capitulum, trochlea. Yeah, so here this is called as lateral epicondyle, this is called as medial epicondyle. The lateral end of the lower end of the humerus has an elevation called as lateral epicondyle, medial epicondyle. In between them there is capitulum and trochlea, and there is also this linear elevations called as ridge, lateral supracondyle ridge and medial supracondyle ridge. Lateral medially there are linear elevations. Yeah, similarly, if you see the skull, you can see canal giving to cavities. So canal is a term given to openings, like optic canal, opening for optic nerve. Yeah, fissures is also the term given to openings. Yeah, here, yeah, foramina is also given the term, is a term given to openings. This is for mental nerve. Yeah, these are the process, mastoid process. This is a term given to some elevations. Foramen magnum, this is also a opening. Yeah, stylar process is a sharp elevation coming from the temporal bone. Yeah, yeah. Finally, after knowing these terminologies that we use for muscle, bone, or vessels, and we also discussed about many terms used in regional anatomy related to movements, etc. We need to know the arrangement of structures in the body from within outwards, from inside to outside. So as we know, the main framework is bones. Inside the innermost structure of our body is bones. So bones form the supporting framework of the body. These bones are supported by what? Muscles, like this. These bones are supported by muscles surrounding muscles, bones having muscles. So muscles muscles are attached to the bones with their origins and insertions, that we know. Yeah, next. After that, above them there will be blood vessels, nerves, and lymphatics from the neurovascular bundles. What is neurovascular bundle? Neurovascular bundles. Neuro means nerves, vascular, arteries, veins, and lymphatics together. All this together called as neurovascular bundles. So usually these course in between the muscles along the facial planes. So these neurovascular bundles cross in between the muscles along some facial planes. That is, they are surrounded by some facial planes. Yeah, next, this is about upper limb and lower limb. I mean, about the abdomen and thorax. The thorax and abdominal cavities, they contain several internal organs. They have several internal organs called as viscera, like heart, lungs, kidneys, etc. So all this whole body now, that is the skeletal framework with muscles and neurovascular bundle in the limbs, and the thoracic and abdominal cavities with the internal organs called as viscera. All this internal framework is supported, all this whole body is covered by three general coverings outside, namely skin. On the outside, just below the skin, there is a fascia. Fascia is a fibrous tissue called as superficial fascia, and inside the third layer is deep fascia. So there are three general coverings for all the internal structural framework of the human body. These three coverings from outside inside are skin, superficial fascia, and deep fascia, which you will be knowing during your dissection hall sections.